Hello everyone. Today's video is about a cool new test that I am excited to share with you about. It is a screening test for colon cancer, and I'll get into the details in just a second. Just as per usual, I want to clarify that nothing I'm saying in this video should be construed as medical advice. This is all for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And also, if at some point you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate that as well. So thanks in advance for taking a second to do that. So the test that I'm referring to is a test called the SHIELD test. It was created by a company called Guardant Health. It's been out for quite a while, but maybe, I don't know, several months ago, I don't remember how many months ago, it received FDA approval. And so nothing has changed about the test, but now that it has that stamp of approval from the FDA, of course, that in many people's eyes, elevates it to a higher level of credibility. It's, past a certain threshold, and now it's FDA approved. And so one of my patients told me about the test. I had not heard of it. Guardant Health is an American company, and we use American companies all the time for different tests, but I just hadn't heard about this one. And so she was telling me about it, and so I looked into it, and anyways, I was very, very interested in it because essentially it's a test that, to my understanding, was developed to help improve the compliance for colon cancer screening. Generally speaking, generally speaking, when folks get the little, at a certain age, start to get the test in the mail, at least here in Canada anyways, when you hit a certain vintage, you start to get a test in the mail for a stool sample, send it in, they test for the presence of occult blood, i.e. blood that you can't see, but microscopically can detect in the stool. And then if that comes back positive, then maybe the test is going to be repeated, and then if it comes up positive again, it's like, well, it's probably time to get a colonoscopy to see where's that blood coming from. And if a fecal occult blood test is positive, then it's got a pretty decent correlation with picking up whether there might be colon cancer afoot. But ultimately the colonoscopy is the test to be done to look for any suspicious lesions or obvious cancer growing in the bowel. The challenge with colonoscopies is that some folks really don't like to have them done, and the compliance rate for them is not fantastic. And then especially when there's maybe family history of colon cancer, various other reasons, maybe some other predisposing factors. Some folks they kind of skip the fecal occult blood test, the stool test in the mail, so to speak, and then just are recommended to go for the colonoscopy. But some folks just don't want to have them done for whatever reason. And so this test was developed to help try to improve the compliance for colon cancer screening, because this is a blood test that's basically looking for evidence of colon cancer in the bloodstream. And so well, no test is perfect, and this test included. The stats on it are pretty good, to the point where I decided to reach out to, well, I asked my wonderful staff members to reach out to Guardant Health and set up an account for us, and we're now offering this test at our clinic. So I just wanted to create a quick video kind of talking about the test, just so folks know that it's an option that's out there, and if it's something that might fit their bill for whatever reason, then now you can know about it and talk to your healthcare provider about the test if you think that it's something that you might want to pursue. Or tell your healthcare provider about it, because I think it's just kind of good to know what's out there. So just a couple of things I wanted to mention about the test. Again, it's not a perfect test, but the stats on it, I just have them up on my screen here. So the overall sensitivity in detecting individuals with colorectal cancer is 83%. Now that's an average number. When you actually look at the stratification based on the staging of colon cancer, the sensitivity for it, so in other words, the accuracy or ability for it to detect a positive case is for stage 1, if it's a pathology confirmed stage 1, it's a 65% sensitivity, which is not fantastic. 65% is like, that's kind of a meh number in my opinion. But then if the colon cancer has progressed to stage 2, it's got a 100% sensitivity. If it's stage 3, it's a 100% sensitivity. It's a stage 4, it's a 100% sensitivity. So the test appears to be, from the data that I've seen here, very accurate when it comes to picking up cancer that has progressed beyond stage 1. Obviously, it's a lot better to pick up a cancer diagnosis at the earliest stage possible. So the fact that it's only 65% for stage 1, it's not great. But just quite frankly, if there was a patient where they or for one reason or another, not willing or not wanting to get a colonoscopy, or maybe unable to get one for some reason. There might be certain reasons why, and yet there was concern about, maybe something developing. Well, it'd be a lot better to know that, before they started developing lots of bleeding or severe pain or something that might necessitate getting a CT scan or something to be actually looking for a larger mass. So again, this test, in my opinion, it's not something that would circumvent the need for the fecal occult blood testing or colonoscopies or this or that. But again, it's just another option for folks. So I have some patients in my practice where they've been very excited to learn about this test being an option, and so that's what anyways, that's why we're offering it, because again, we want to meet folks where they're at and work with whatever testing or steps forward kind of fit the best with their goals and wishes and all of that. The one other thing I'll just mention here quickly in the video is that there are certain inclusion criteria for having this test done, or flipping it the other way, there are certain exclusion criteria where the company advises not having this test done. So just reading that off quickly here. So if a patient had a personal history of colorectal cancer, which makes sense, because if you already, this test is really telling us, like, is there cancer or not? Now, I suppose if a patient had been treated, they're basically saying, like, this isn't recommended as a test to see, like, is the cancer back? So I suppose that's probably what they're getting at there. If the patient has any adenomas or any related cancers, if they have a positive results for via another colorectal screening method within the last 6 months, if they've been diagnosed with a condition associated with a high risk for colorectal cancer, such as inflammatory bowel disease, chronic ulcerative colitis, or Crohn's disease, or if they have a family history of colorectal cancer. So that casts a pretty broad net in terms of certain criteria that would not would preclude a person from having this test done, but not a massive net. So it's still, many folks out there are going to be, sort of eligible for this test if that's something they wanted to pursue. With the test, it's very simple from the point of view. It's just a simple blood draw, there's no prep required. It doesn't have to be fasting. Any time of day is fine. So it's very user-friendly from that perspective. The test, in my opinion, is quite expensive. Since it obtained FDA approval, the price shot up quite a bit, to my understanding, which is what happens when a test gains more legitimacy, shall we say, then prices tend to go up. But generally speaking, and I don't want to quote any direct numbers here, just because the price could change, and I don't know when somebody's going to be accessing this video, but at the time of recording, which is October of 2024, then the price is in US dollars is $895 US to get the testing done. So it's an expensive test in my opinion. That price, just for the record, is the amount that's paid to the lab directly when we run tests here at our clinic. We don't mark up tests or anything like that. Patients just pay the lab directly, and we don't have any financial relationship with the lab at all. So as I'm fond of saying to my patients, don't shoot the messenger that it's expensive. I'm not making any money from the lab whatsoever, but that's basically what the cost of the test is at this point in time for us here in beautiful Canada land. So just FYI, expensive test, but for some folks, it's maybe the better choice for them, and it might be something that is worth that chunk of change. So I'll leave it there for now. If anybody has any questions or comments on this topic, please post in the comment section below. And if you have any questions or comments on anything else, also feel free to post in the comment section below, and I will do my best to answer as soon as I can.